is Laura, Laura Armstrong. I have recently learned there's a lot of Armstrongs from this area, but I'm not related to any that I know of. I'm just going to be giving the short and sweet finale on the electrolyte needs of the scouring calves that Colleen was just talking about. So first of all, in order to tube a calf, you need to be prepared with the supplies that you need. So it's not a very extensive list. You'll need whatever fluid you're planning on supplementing, whether it be colostrum, electrolytes, or just even milk replacer. A bucket of warm water, especially for right now when it's so cold out. The actual bag feeder and some disinfectant for afterwards. I also recommend having a separate bag feeder for scouring calves versus calves that are just born and you're giving colostrum to keep it kind of clean versus dirty. So, to get ready for tubing, you prepare your fluid, make sure it's warm so the calf can absorb it properly, and ensure that it's an appropriate amount. So say if you have a scouring calf that's smaller, about 60 pounds, I'd usually aim to tube them for about 1 liter. 2 liter will probably be too much for them. But if you have a large calf, 2 liters would be more than fine. If it is cold outside, you can put the tube in the warm water to warm it up so it's not such a shock to the calf, as well as to lubricate it to make passing the tube easier. Before you place the tube in the mouth, you want to make sure that or even before you add your fluids, you want to make sure that the tube is occluded so you don't just immediately dump it on the ground. You want to put your prepared fluids into the bag and then appropriately restrain the calf. I personally prefer to have them when they're in like a sternal, so sitting upright on their chest position, and I find it easier to just straddle their back and hold them still that way. And before you put the tube into the mouth, you want to measure the distance from about 3/4 of the way down their neck to the corner of their mouth. And then you have an idea on where the tube, or how far you need to be putting it into the calf. So this is a tricky part. I like to put the tube in the corner of the mouth instead of trying to jam it in straight away. They usually accept that better. And once the tube is in the mouth, you straighten it out and then proceed to the back of the mouth. You can usually feel when that bulb hits the very back, and you wait for them to gently swallow, and you advance the tube that way. This is a good checkpoint to have for yourself that the calf is sitting there comfortably and not obviously coughing. If they're coughing, that probably means you're in the wrong tube. I would back out and try again. So, once you get the tube to that pre-measured portion, what you can do is again make sure they're not coughing, release the stopper on the bag, and hold the bag up high enough so you get a good flow of fluid. If the calf is coughing or you immediately get some reflux or stomach contents coming up through the mouth, and stop immediately. And another trick too is to, with one hand, hold the tube in the calf's mouth so it doesn't wiggle around and the calf doesn't chew it or break it or do anything that would be detrimental. Once you've given the whole volume of the bag, you can stop. This is important too. You pinch that tube so when you pull it out, you don't get any extra fluid that comes out of the line and could go into the calf's lungs. When you're done, you want to rinse, clean it with soap and warm water, and then spray it with that disinfectant and leave it to dry for the next calf. Do you have any questions on that review? Okay, so for the different stages of dehydration that comes with scours, mildly dehydrated calves, they're the ones that, they're standing, they're alert, they've got a little bit of a gross butt, but otherwise they look pretty okay. If you tent their skin, the tent that is created should go away in less than 5 seconds. And they have that suckle reflex that Greg was talking about earlier. And another way to tell how dehydrated they are is how sunken their eye is into the eye socket. Because as they get more and more dehydrated, they kind of shrivel up like a raisin, and their eyes get sucked in that way. So these calves that are feeling not great but not bad, they require about 4 to 6 liters of fluid per day, and that's including milk and electrolytes. So we'd recommend giving 2 to 4 liters of electrolytes daily. So that's about 2 feedings if it's a 100-pound calf. I would reassess these calves daily and make sure that they're nursing and improving and not getting worse. And if they are not improving by the 2 to 3 day mark, that would be the time to call the vet and ask what else you can do for them. Moderately dehydrated calves. So these are the calves that are acting depressed. They can be either standing or lying. If you do the skin tent is longer than 5 seconds, and that indicates that they're greater than 6% dehydrated. They will have a weaker suckle reflex, and they will have slightly receded eyeballs. So these calves, they're more dehydrated, so they require more fluid to make up for what they're losing out their back end. They require 6 to 8 liters of fluid per day, and of that, 4 to 6 liters of electrolytes, but it's still that 1 to 2 liters per feeding, depending on the size of the calf. So these are the ones you want to watch more closely, and if they are not nursing from the cow, that would be the time to tube them with electrolytes as well as milk to make sure they're getting that energy they need to fight off whatever bug they have. And if these guys don't improve in 12 hours, that would be the time to call the vet. And finally, the severely dehydrated calves. This is a calf that was born in a snowbank in April of last year. And so this calf was down and out. They're the ones that are lying on their side. They're not really responsive. You stick your finger in their mouth, they don't want to suck. Their eyes are really receded into their skull, and they're cold. So these calves need attention immediately. If you're able to prop them up on their chest and they willingly will kind of swallow and get that tube down their throat, then you can give them 1 to 2 liters of fluids just to give them something, and then call the vet. And that was my short and sweet summary on tubing calves. Did you have any questions for me?